All right, welcome everyone. We are in our last week of our Project ECHO course, which is the Introduction to Palliative Care in Humanitarian Settings for East Africa. And we're so glad you're with us. We've been on a journey for the last few months, and we're really excited to be in our last class. A lot of you have been catching up. You've been emailing me, which is great that you've listened to the recordings and you've done the quizzes. We are in our last week, so thank you for being with us online today live, and those that will listen to this recording afterwards, that's great too. Today we're going to be talking about self-care, and the word self-care might not be a word you are familiar with. It is something that's coming up more and more, especially since COVID, about ways that we can provide self-care within healthcare. So I'll be the one presenting today, and then Esther Beatty, our nurse from Canada that supports work in Senegal, will be doing the case presentation. And we'll hopefully be having lots of time for interaction and chat. If you do need to go, or if you have a question, just put it in the chat and let us know. And then I guess Lamek, if you, or Annalise, if you can watch the chat, and if something comes up that I need to stop presenting about, just let me know. Just unmute and just interrupt. It's no problem. And again, please introduce yourself in the chat. We love to know where you're from. We have people calling in from all over, which is great. And it's really something that we really appreciate in this sort of training. All right, so let's get right to it. The topic for today is self-care. So if you want to get your pen and your notebook, today we might be talking about things you haven't necessarily talked about before, and it may be some quotes or some things you might want to follow up on. So please do get your notebooks and your pen out. So we'll be talking about self-care, how to maintain resilience while we witness suffering. It's something that as you learn more and more about palliative care, you will come to understand that a big part of our work is witnessing suffering. I know when Dr. Jessie was doing her talk, she talked about sitting with suffering. I think this is a big part of what we do in palliative care. So after today's session, I'm hoping that you'll be able to explain what self-care is and why is it so important. We'll also want you to be able to identify challenging clinical experiences in your own setting, and then find ways to develop some strategies for your own self-care and possibly even create a plan for yourself. So there's a quote by Rachel Naomi Reman that says, the expectation that we can be immersed in suffering and loss daily, that is in working in palliative care, and not be touched by it, is an unrealistic as expecting to be able to walk through water without getting wet. I want you to think about this quote. So again, as we think about palliative care, as we think about our work in humanitarian settings, the expectation that we can be immersed in suffering and loss daily and not be touched by it is as unrealistic as expecting to be able to walk through water without getting wet. So now as we think about that, I want you to open up your chat box and I want you to think about what causes you distress in your job. So you may be just coming off a long shift. I know some of our colleagues here work 12-hour shifts, some work just 8-hour shifts, some are in a more 9-to-5 role, some are studying. But if you think about what your job is, what at the moment can cause you distress? I'll just open up my chat as well, and I'd love to hear what your thoughts are on that. If I think about my work right now, I'm working in Kenya, and a lot of the work that I do is quite remote. So one of the things that causes distress for me in my work is not necessarily being able to fully understand the projects that I support or the people or individuals that I support. Do you want to put in the chat, or does someone want to unmute and share what causes distress in their job? All right, I'll keep my eye on the chat. We'll keep going. Oh, we've got a few people. Seeing families suffer for sure. I think the suffering that we see with many of our refugee families or internally displaced people, then on top of that, having a life-threatening illness. Possibly they've gone through trauma ahead of time, frequent exposure to suffering for sure, and death. A lot of the families that we serve, and now with our more experience we have in palliative care, we see the suffering and the trauma people have experienced, and we also need to provide for their physical needs, the pain that they experience for sure, burnout, feeling helpless, not being able to support other families financially. Yeah, it's a huge financial burden to many of our families when they have serious health-related suffering. When children are not able to have their pain managed, for sure. Feeling like a family has so much suffering and you can't make much impact. Family distress with overload. Really good. You guys are on the ball. You were all just typing maybe while I was asking that question. Which is great. I love the interaction that we can have during these sessions. Working under limited resource settings, for sure. What happens when we don't have enough resources or we don't have the things we think we need to provide the care that we would like to provide? Lack of cooperation, long hours, frustrating and disheartening is when we're disconnected, when family members are disconnected, when it's not peaceful, for sure. Seeing elderly people bedridden, bed sores. You guys are really getting it. Good. Long hours, poor working conditions. Yes, this is a lot. All right, let's go back to our quote. You remember the quote I started the session with? Yes, the lists are really long. I totally agree, Edna. The expectation that we can be immersed in suffering and loss daily and not be touched by it is as unrealistic as expecting to be able to walk through water without getting wet. And I want you to think about this as we think about what self-care really means for those working in palliative care and even humanitarian settings. We need to understand that it's unrealistic for us to do this job and think that we're going to be strong enough. We need to find ways to support ourselves. And I think this list is very similar to the one that you just shared. What causes us stress? Feeling that the care you are doing is not good enough or not, it's not a good job, frequent exposures, communication difficulties, team conflict, work overload. A lot of these things you guys already put in the chat, and you can continue. Today is actually hopefully going to be actually also therapeutic for you as you share. This is a safe group. We've been a group now for the last 2.5 months, and I do hope you find this is a place that you can unload yourself. So why are we talking about self-care? Working in humanitarian settings is really difficult, as some of our patients will die despite our best efforts and even the best efforts of those around us. And we know that pain and sadness is inevitable in many of the places where we're working, but we want you to begin to shift your focus, knowing that suffering might be optional. And I think that might be a takeaway that you hopefully learned from this course. We are here to reduce the amount of suffering that our patients and our families experience. So we're going to do another activity now. So I do really hope you have your notebook similar to this and your pen or a small piece of paper, because we're actually going to do a self-care activity. So I want you to look at the next 5 questions and you're going to rate them out of 5. So here's the question. So this is over the last 2 weeks. This was a survey done by the WHO. The first question is, I felt cheerful and in good spirits. Number 5, which is all the time. Number 4, which is most of the time. Number 3, which is more than half of the time. Number 2, less than half of the time. And 1 is some of the time. And no time at all is a 0. So I want you to look at question 1 and then give yourself a score out of 5. We're going to do 5 of these questions. and I'll do it too, and then we'll look at the scores and see how we're doing. So I felt cheerful and in good spirits. How often of the time? Number 2, I felt calm and relaxed. All of the time, most of the time, more than half of the time, less than half of the time, some of the time, or none of the time. Number 3, question number 3 is, I felt active and vigorous. Active and vigorous. All of the time, most of the time, more than half of the time, less than half of the time, and then some of the time, or no time at all. Over the last 2 weeks. So think of the last few weeks, maybe just after Easter holiday through Ramadan. Question number 4 is, I woke up feeling fresh and rested. So you get a score of 5 if it's all of the time, 4, most of the time, half of the time, and so on. And the last one is, my daily life has been filled with things that interest me. 5, 4, 3, 2, 1. 5 being all the time and 0 being none of the time. Now you're going to have to do some primary school math, or you can get your calculator out on your phone. And please add it up, and you should get a score out of 25. All right, so now that you have your score out of 25, I want you to multiply that by 4, and then we're going to get a score out of 100. So add your score up, and then times that by 4, and then you'll get your score. Okay, so my score is 80. If you feel comfortable, you can put in the chat box your total score. So add up all your scores. So I see some people putting in their individual score. So make sure you add up your score and then times it by 4. So my total score was 80. I see someone else. Kim is good. We have 64. Good. Nadia, I think you need to possibly times yours by 4. If not, that's a fairly low score. Make sure you times it by 4. Add all your points up, and it should be a total out of 25. Maybe Nadia actually, maybe your score is low. Victor, I see you got 1, 1, 1, 1, 1. So your score will be quite low, 50. Sorry, 40 also. Okay, continue to share your scores, and then I'm gonna share a little bit about what the scores actually mean. Sorry, Nadia. Thank you for sharing, though. Thank you for sharing today. So this is a self-administered questionnaire, and it's shown to reliably measure our emotional functioning. So we did our score, and then we multiplied it by 4. A higher score means better well-being. So evidence suggests that a score of 40 or below actually indicates a low mood, but not necessarily depression. So if you're at a 50 or below, it means that your mood isn't the best right now, based on those questions. And a score of 28 or below likely indicates depression. And for that, obviously we would want you to reach out. So if today you have kind of noticed that you're really not doing well, please do email me or reach out, because this is something that we want to make sure that we do support one another in. These are short ways and small ways that we can really identify if we're really not doing good. And I mean, even doing this test and sharing your score is a really vulnerable thing to do, but it's really, really important, because we know as clinicians, we have an intense personal involvement with our patients and our families. There's courage, healing, and growth with these encounters that we have, but it's also an area where we are very vulnerable and we can experience grief. We do this because we repeatedly need to empathize. And this is really necessary for the care that we give, but it can lead to trauma, vicarious trauma that we experience each time. And as we seek to enhance the quality of life of our patients, we must respond to the emotions and the needs of the family. And actually, sometimes this can be difficult for us to do day in and day out. So the common responses to this kind of stress is actually burnout. You might have heard that, especially during COVID. We talked a lot about burnout and clinicians and healthcare workers and caregivers experiencing burnout. And it is a reality. So it's a progressive loss of idealism, energy, and purpose experienced by people in the helping profession as a result of the conditions that they work in. It can be physical, emotional exhaustion, personal depersonalization to the approach that they give to patients. And sometimes they also have a lack of achievement or they sense incompetence. It can also lead to moral distress. And this is when we have the inability to act in a manner that's consistent to one's personal or professional values because of external constraints, institutional constraints, things within the system that we can't necessarily change. And the last one is compassion fatigue. We often find that people working in these stressful situations, whether it's a humanitarian setting or in palliative care in a limited resource setting, we often find that we have diminished emotional energy that's needed to care for our patients. There's some things that can predispose us. So in our work setting, sometimes work overload. At the very beginning of class, we talked about what are some of the things that you experience, and sometimes these are inevitable. This will most likely happen if you are going to experience work overload, having large patient volumes, not enough resources, feeling poorly managed. If you don't really have control over your work environment, if you spend a lot of time on things that are not consistent with your career goals or your work, sometimes interfering with your home life. These are things that can predispose us to things like burnout or compassion fatigue. It's interesting though, sometimes our personal characteristics also predispose us. So it causes us or gives us higher chance of being burnt out. Sometimes it can actually happen for people who are early in their career. Again, having lacking a sense of control over events, attributing success to the chance to instead of personal accomplishment, sometimes being overcommitted. Having an inability to admit to mistakes can lead to burnout, needing for absolute certainty in our work. Sometimes even a lack of sense of humor. I think in palliative care, sometimes it's hard to be humorous, but it is something we need. And if you believe that compassion fatigue is just expected as part of your job, then you'll be predisposed to experiencing stress and burnout. Some things, though, are protective. So as we think of things that we predispose us to being burnt out or to needing to really identify ways to care for ourselves, some things are protective. So some things are good to show that you are committed to something. You're committed to personal growth, to hard work, caring, being rational and being self-aware. These are things that are really helpful in the work that we do in palliative care. So some people argue there's no real reason or need for self-care. And one of our arguments against that is that reflective practice in self-care should be something that is part of your ongoing routine, similar to keeping up to date with conferences or reading journals. So in our specific area in palliative care, self-care actually needs to be seen as professional development. It is really, really important because of all the things we just mentioned. If we can't make this a priority, we will physically, emotionally, psychologically, and probably spiritually burn out in our work. The argument number 2 is we want to avoid burnout. So emotional exhaustion isn't easy. To be emotionally exhausted, you often get overextended. You are not able to do your work well. We end up treating patients as objects. So there's a large word here, but it's depersonalization. We don't personalize the work or the people that we're engaging with. And we sometimes sense low personal accomplishment. We don't feel adequate, and we don't feel like we're doing a good job. And the last argument is in terms of not really prioritizing self-care is we actually want to also avoid the negative effects of burnout. So in 2012, Lieben and Remke said that when not recognized and accepted for what they are, painful thoughts and emotions are managed with dysfunctional coping in the form of denying, concealing, avoiding, and numbing, which eventually reemerge as possibly addiction or dissatisfaction with work and family life. And this is something that, of course, we're talking about self-care and it adding to our work, but we also know that there's a lot of negative effects of burnout and stress in the workplace. And here we go. So here's some of the other impacts that we know can occur. Medical errors can occur, low patient satisfaction, longer post-discharge recovery for patients, sometimes unprofessional conduct, avoiding work or specific work tasks, which are difficult. And sometimes we even have people who exit the profession. We have people that avoid dealing with these emotions that they're experiencing. And these are real serious impacts. And I'm sure some of you may have seen colleagues that have experienced this, or even you may have experienced this yourself. So as we shift into a reflective time, what makes your job fulfilling? At the very beginning of class, I got you to write down all the things that were very stressful. But as we move forward in the session today, I want you to think of maybe just one thing. If you can think of more, great. But if you can think of one thing that makes your job fulfilling, can you also share that in the chat? I see some of you have also shared your total scores. So some pretty low, some in the middle range. But what makes your job fulfilling? So we've talked a lot about the impacts, things that can predispose us to stress and burnout. Good, human connection. Human connection can make our job so fulfilling. Seeing patients recover from an illness, for sure, Nadia, I really appreciate that. When people appreciate the work that we do, for sure, when our patients smile, even a simple emotional reaction such as a smile can really make a hard, long shift worth it. Being able to serve others gives us joy. Yeah, Elizabeth, sharing when our patients are pain-free. When we've assessed someone's pain, we've managed it, we've set up a plan, and then the patient actually reports less pain, it really is so fulfilling for sure. When we see medical equipment that's available and patients that are responding to treatment, for sure, it really helps. Being able to realize that a patient feels acknowledged and attended to. You know, when we make a difference in even just one patient's illness trajectory, right, in their journey, good communication, good proper teamwork, for sure. Communication is so important. When a patient are pain-free, positive feedback, yeah, positive responses from patients. These are great. These are all so, so important. Keep them coming. I'll kind of check into the chat in just a minute. But we know that some of the rewards for working in healthcare is that families are often very satisfied with the work that we provide. We can have deep, positive relationships with our patients. And we know that palliative care can have a major impact on a person's quality of life. And we've talked a lot about ways that we can reduce suffering in the things that we do in palliative care. So it actually can change your perspective and perception of life. It helps you value life. It allows you to reflect on your own morality and what's important to you. It increases your self-awareness, and you're able to cope with stress and suffering differently. And you begin to appreciate joys in life as you engage in palliative care and this work. It is very satisfying to do a good job caring for patients. And it allows us to stop feeling that death of a patient was a professional failure. And I think this is the area of palliative care, especially within limited resource settings and within humanitarian settings, that is really, really hard. And we may be one of the only people on our healthcare team that actually agrees with this statement. And I think it is a reward that we slowly but surely hope to be able to change. But at the beginning, you might be the only person who feels this way, but it is a reward. And I think even with courses like this, we're creating a community that also believes the same thing. So as we think about all the stress that we experience in palliative care and now some of the fulfilling things, we can shift our focus onto what self-care actually is. So self-care is the knowledge of our own strengths, our weaknesses, and even sometimes our triggers. It's achieved through an innate or learned, you can learn this practice of being self-aware, where we focus our attention on the present moment through reflective practice. And it is really important that it's action-oriented. So caring for yourself, asking for help, learning a new skill, changing your approach. So I want to do something now that we're going to do all together. So what you're going to do is I want you to sit wherever you're sitting and put your feet on the ground. And I want you to stop. So stop what you're doing. Some of you have your video on, some of you don't. Some of you might be doing something and more listening to the lecture today, but some of you might be sitting and at a table. I want you to stop, put your pen down, and consciously recognize what's going on around you. Stop. Take a deep breath. I want you then to observe some of the sounds that you can hear. Maybe there's people in the background, maybe there's music. Maybe there's patients or children shouting. Maybe there's traffic. Observe what's going on around you. And now we're going to proceed. So this activity of stopping, S-T-O-P, is actually something that I want you to think about possibly doing this week when you see a patient. So right before seeing a patient, maybe it's a complicated case, or it's a case where you know there was a lot of conflict amongst the family. I want you to try this. I want you to stop for 5 to 10 seconds wherever you are, whether that's at the intake desk, whether that's in the staff room, whether that's right in front of the patient's door, and take a deep breath. You take a short inhale and then a long exhale. Focus on your physical, this physical sensation of your breathing. Observe what's going on around you and how you feel. And then you proceed. This shouldn't take very long. It won't take more than a minute to do this. And I want you guys to share in the chat next week, even though we won't have class, maybe on our WhatsApp, how that went. How did it go when you stopped before you saw this patient or before you went into a very difficult situation? And you can share back with us. We're also going to talk about today some examples of what a self-care plan could be. So there's a few different areas of what we're going to share about. So a physical area, an emotional area, psychosocial area, and then even spiritual. So for some people, it could mean regular exercise, such as a walk, hiking, yoga. Some people run. Maybe some people ride their bikes or jog. Emotional self-care plan is identifying some person that can be a support to you. They can be within your team, or it could be a friend, a close friend that you know, someone within your family, maybe a colleague, but not on your team. Maybe it's someone that you've met through this course. Psychosocial is all about planning fun things to do. So do you like to dance? Do you like to cook? Do you like watching movies, maybe watching football? What are the fun things you like to do? Do you like to hang out with your kids on the weekends or on your off days? And then spiritually, what nourishes you? Do you have a particular spiritual practice that's really important to you? Do you pray? You meditate? You take a walk in nature? Do you attend church? Do you go to mosque? Do you perform different religious activities that are really important to you and help you care for yourself? So this is some homework. I'm going to end up putting this in the chat while we're doing our case, but I want you to plan your own self-care in 3 steps. The first one is your intention to give attention to your own well-being. So you need to be intentional. You need to think about it. The best thing I think is to write it down. That can be in a journal or it can be in your work notebook. It's important to be conscious of mindful appreciation of what you already enjoy about your job. That's what we were just talking about. What are those things that you really enjoy about your job? And then the final one is finding and doing things that shift you from reacting to responding. So sometimes we react to difficult situations at work and we're angry or we're frustrated or we're kind of downcast about the situation, we're disappointed. But actually we want you to begin to respond. Find ways, small things even, that you can do to respond to the situation that's so difficult. And some of that you might have learned, some of those skills you might have learned through this course. So in summary, there's courage, healing, and growth in our palliative care patient encounters. And we've talked about that so much today. But also there's vulnerability and there's some personal grief that we experience. There's a very high risk of burnout, moral distress, and compassion fatigue in professionals that are providing palliative care, especially in your settings where we provide this type of care in humanitarian emergencies, oftentimes in refugee camps or internally displaced people's camps. And oftentimes our situations are very limited in the resources we have. And I really urge you as healthcare professionals to cultivate and maintain personal and even team strategies, if you're on the call today with a team, on ways to prevent as well as reduce the impact of these things, such as burnout, distress, and compassion fatigue. So what are some of the myths that we have talked about a little bit? Self-care is selfish. I think after today, we agree that this is really important. It isn't selfish. It is such an integral aspect of the work that we do. And I think if we don't prioritize self-care within moderation, of course, it will allow us to do our work for many years rather than just days and weeks. Myth number 2, the effective self-care are temporary. Sometimes we think of self-care and the work that, taking a walk, the effects are just for that day, but actually our awareness of nature, understanding that this is an important thing that we should bring into our routines on a regular basis is really important. And it can last to lifelong changes in our outlook and our attitude. One of our interesting myths here is that self-care is just for women. Has anyone ever heard of that? Women love to go and get their hair done or go get their nails done. This isn't something that is true. Self-care is just as important for our male colleagues as it is for women. And just in many cultures, men are often not as in tune with their emotions, but it's super important, especially for our colleagues that are men, especially in this group, that they become more aware of their emotions. They find ways to get in tune with their emotional side. There's another myth, self-care sometimes takes too much time. You don't have time to spend time with your family or go for a walk or meditate. This is really a barrier for a lot of people, but self-care can be very short. And oftentimes, once you begin to see the effects of it, you will prioritize this and make more time to do this. Self-care is doing anything that soothes you. I don't know if you've heard of that myth before, but sometimes people believe that overindulgence is important to self-care, but actually it is within moderation. We know that if one way that you enjoy and can relax after work is to eat, and you love eating ice cream or crisps or fast food because it's easy and it really does help you wind down after a long shift, you need to be aware that you can't be doing that every single day and that it is within moderation. We do need to be aware of the decisions that we make as we take care of ourselves. And then the last one is self-care as the same for everyone. So that is actually not true. Self-care is very different. And that's why I'll be sharing that list of how to make your own plan and how to reflect on what to do, because actually my self-care plan is very different than even my husband's if he was working in healthcare, or even our colleagues or other faculty members here, my self-care plan can be very different than what Esther's or Annalise's plan is for them. So our final thing, what's our checklist? How long, number one, how long has it been since you had your proper meal? Think about it. I hope it was today, but if not, you need to make sure you eat. Number two, how much water have you drank or consumed in the last 24 hours? If it's only 1 glass, that's probably not enough, so please stay hydrated. How many hours of sleep have you had in the last 24 hours? Depending if you're just coming off a 12-hour shift, that might be a bit different, but please make sure you sleep, make sure you rest. How long has it been since you went outside or you got some exercise? This might be different for everyone, but it's really important and we can hold each other accountable. It's really important that we exercise, we walk, do something that will help release those endorphins that we know exercise does. And then the last one, when was the last time you met someone in person? When was the last time you had an emotional interaction with someone? And this is so important to our self-care because we really need to connect. And I just wanted to share with all of you, you guys are my virtual colleagues and friends that today, April 25th, last year, my daughter was born at just 5 months old, and we spent 1 hour or so with her, and I wanted to share this because today I'm sharing the lecture on self-care in memory of her. She died just 1 hour after, and I have 3 beautiful sons and 1 beautiful daughter that is no longer with us, but I just wanted to share that with you today. I do thank you guys all for the support that you have given through this course, and I wanted to do this in memory of her. Thanks, everyone. If anyone has any questions or comments on how they do their own self-care, please do share. And I know we have people from many different cultures here. So I'd be really curious to hear if there's some things related to self-care that we may have missed, or something that you would like to share in your particular area that you guys really enjoy doing as a team. To take care of yourself. Yeah, Tabella, go ahead.
Thank you very much indeed for this elaborative and informative session to really inform us of how we can be resilient and be able to cope with the demands from patients and families, and sometimes even the pressure of work in general. And for me personally, I think what I've noticed, the technique you have just given us of stop, it really works so well. And again, when I feel like there's too much pressure, or maybe you are distressed emotionally by seeing the pain and the suffering of the patient, and maybe even when you escalated the concern to the doctors, maybe about oh, this patient might need some more painkillers, or it looks like this patient is really deteriorating in a way that even though we are pursuing active treatment, we might need to now, change lanes and involve the family and all that. And you find that maybe there's a delay in response. I usually take a small brief break to the bathroom, where you can be just by yourself and clear your mind of any maybe quick decisions or thinking that you might have had in the moment of just seeing the suffering. How does it impact my thinking and my emotions? I don't have to really use that toilet. I just stand there in front of that mirror and listen to my spirit and soul. And it tends to really help me to really get me focused without being overwhelmed by the situation. And again, I think the walking and the exercise, getting the target of 30 ml per kg of our body weight drinking every day, whether we are thirsty or not, just pushing that fluid down. It tends to help us stay hydrated. But I just want to thank you personally for sharing your own personal space, allowing yourself to be vulnerable by sharing such emotional moment for you and your family. And we just say, may you all stay with all good memories of even those brief moments you shared with her. But I think you were just giving us a lesson again, just to allow us to be humans, to be vulnerable, to share how we feel and our experiences with our colleagues or those people we trust, or our families, or even if we get the personal mentors. It doesn't have to be the paid one. It could be a member of church that you pray together with, or a closer person that you feel comfortable that what you pour out to them is actually going to be something that they can give you back, some kind of listening. So thank you very much, Erin, for all that you have shared with us and the whole faculty team over this couple of weeks, and grateful for all the support we got for the people of Lesotho. And I hope everyone enjoyed the sessions that I have, and thank you.
Thanks, Sabella. Yeah, I think it is really important to remember that it's good to kind of reach out to even just one person, that accountability person that will be able to listen to you during difficult times, but also bring you up. It's not, yeah, the work that we do isn't necessarily easy to talk about when you're out for dinner with your friends. So you do need to find somebody that will engage with you, that will be empathetic. And I think it's really important. You can't not talk about what we do. Sometimes it can be, your partner, a really close friend, but I think it's really important to identify who that is in your life. But thanks so much, Tabella, for sharing. Thank you. And there's a few comments in the chat. Just talking about how to engage. It's really important that we take care of ourselves as we alleviate pain and suffering among patients. It's really true. There's this one picture or comment in one of the other self-care sessions that I've attended where it has the oxygen mask. You guys know that on a plane. Do you remember when they used to make that announcement, please put your own oxygen mask on first so that you can take care of the person beside you? It's very similar to the work that we're doing. If we're not taking care of ourselves and putting that oxygen mask on ourselves, we actually won't be able to do the life-giving work that we are doing in palliative care. Self-care is so important as far as dealing with patients with terminal illnesses. Yes, and we'll definitely share the session for today. Caring for patients has changed. Yeah. Thank you everyone for the kind thoughts. I really appreciate it. It was a bit hard to know actually, because today is the same day that she was born and she died, and it was our last class, and I was wondering whether I should just not attend. But actually you guys will appreciate that I did attend. And I know that, yeah, we can do hard things and we can do them together. So thank you. Thank you for allowing me to be with you today. Esther, are you ready? Shall we move on? I can kind of monitor the chat a bit if some other things come in.
Sure, let's see how the internet goes.
Okay.
It kind of comes and goes, but it looks like right now it might be okay. Everyone's eating lunch. No one's on their cell phone.
Oh, nice. All right. So Esther is a palliative care nurse that has been working in Senegal for many years, and she recently returned to Senegal for a short trip to engage and support some extra training with their palliative care services. And we're really grateful that she's been with us as a faculty member for the last 11 weeks. And I'll share my screen so she can present on the cases. for today.
Okay, and thanks, Erin, and to everybody on the course. One thing I love about this course is how much I'm learning from everybody. So I love that in palliative care, we're a team, and we will never know everything. So we meet a lot of really wonderful people working in palliative care as well. So we're going to be talking about 2 cases today. And of course, they're both quite sad. So what I want you to do when we talk about these cases is try to think about how you would feel if you were one of the caregivers. Maybe not get caught up in the technical parts, as sometimes it's easy for us as healthcare workers to do, but let's just look at these cases. So the first case is about a 6-month-old baby who's come to our clinic with progressive weakness, and she's not able to sit and having trouble swallowing. So as we do our assessment, we suspect that she has spinal muscular atrophy. And we know that this is a disease that is progressive and which is non-curable. Usually the life expectancy is less than 2 years. So we get a team together and we talk to the family about the disease and about the unfortunate prognosis. And this family is happy to take their child home to have home-based palliative care, with the plan that every month the nurse is going to visit. And the first month when the nurse visited, the baby is happy and she seems to be doing well, although she still is quite weak. Next slide, Erin. Oh. So on the 2nd month, one morning, the baby Zoya is found dead by her parents, and it looks like she's aspirated in her sleep. Her parents are totally distraught, and the home care team keeps meeting with the parents for bereavement visits. But the home care nurse and the community healthcare workers are also devastated. So here are some questions that you can answer in the chat. What emotions do you think the team might be experiencing? What would you be experiencing if you were part of the team? Do you have any emotions you might be experiencing? Helplessness, for sure. Deep sadness. It's very sad when you think about a 6-year-old baby. Weakness. Yeah, lots of sadness. And the loss. What kind of contributing factors do you think might cause you as a member of the team to experience this maybe differently than other people on the team? Yeah, so I was just wondering if you think that there may be contributing factors. So for example, if I was on the team and I was a young mother, so I had a baby at home, could that contribute to my feelings in this situation? Or if you were a new nurse, maybe, and you don't have much experience with death. So let's move to, being emotionally attached to the family. Connecting with the family for sure, and the family's pain. And for sure, we're in a caring profession, so we're going to care deeply about our patients. What could be some personal self-care strategies in a situation like this? So if you were part of this team, you would know going into it, because you know the prognosis of the baby, that it is going to be very challenging. So what kind of things how can you help yourself and care for yourself? So the team needs to support each other in the family. And the debrief session. So I think it is really important for us to be able to share with each other and recognize how challenging this is for everyone. We need to make sure that we're taking care of ourselves when we're not working. So trying to find ways of maybe not focusing on this all the time when we're not at work. I heard a psychologist talk about, he would walk to work, he would walk home from work, and there was a tree. And every day when he left work, he would leave the patients, he'd say goodbye to them at that tree, just psychologically, and then pick them up the next day when he was coming back to work. So trying to make sure that when you're not at work, you're doing some journaling about our thoughts. I'm not sure if everybody has the opportunity to maybe take time off if you feel like you're being you're getting close to burnout, if you're just exhausted. I know in Canada right now, most people's employments are giving people time off for mental health days. Good idea. Team doing memorial service for each other. Those are good things too. And it looks like we've talked about some team wellness strategies. Do you have any other ones? We've talked about debriefing, checking in. I think eating together seems to be a fun team activity where people can, colleagues can try to get to know each other and maybe not just talk about what's happening at work. Time off work for sure. Case reviews. And I think being, accepting that each person on the team is different. So we might all have a different approach. Personally, I use a lot of humor. I try to find some good and something that is funny that we can laugh about to just make a situation less heavy. Meditation and yoga as well. Laugh therapy does help. And maybe recognizing people on the team when they're doing well. Dance with children, playing with children. That's also really a good way to deal with children in difficult situations. I know some people use art. Some people like to draw how they're feeling. They find that that is a good way to just deal with their feelings. Okay, so let's move to this the second case, which is also a case about a baby. Another very sad case about a 4-month-old baby who comes to the hospital with an enlarged head and a lower back lesion. So we know this baby has meningeal and hydrocephalus. And this baby also was had a positive malaria test and was in respiratory distress. So the O2 sats were 54% on room air, and then went up to 93% on 2.5 liters of oxygen. And there were IV antibiotics and a malaria treatment given. And then the main thing was just trying to figure out what to do for this baby, because as you know, with the diagnosis for anything for this baby, there needs to be a shunt. You can see the diagram there on the next page, Erin. So this 4-month child came in with hydrocephalus and acute illness. This patient was from a rural area, so very far from any hospital, but actually for what this baby needed, it wasn't available in the country. So if they wanted to put a shunt in, they would actually have to transfer the baby to another country. Next slide. So the team talked about this with their advisors on telemedicine, and everyone agreed that at this time, the best thing would not be to put in a VP shunt, because there wouldn't be expertise for follow-up. It would be likely block, and so it wouldn't last for the long term. The cost would be very high, but also they would have to transfer this baby, and there was pretty high likelihood that the baby would die on the way to a treatment center. And that would be very traumatic for the whole family and very costly. Next slide. So the recommendations was for palliative care. So for supportive care for this baby, they discussed with the family that the tap could help the pressure, but even though that did help the pressure, it would be very short term and the fluid would always build again. And having a shunt in would actually cause more possible infections. So it could actually cause the baby to suffer more. So it might, although a shunt might prolong the baby's life, it wouldn't really change or improve the outcome. And then, as I mentioned, the increased chance for infection. Next slide. So after the treatment plan of care was discussed with the family, they accepted it. And the family decided that they wanted to stay at the hospital for the care. The baby recovered from the short-term, the acute illnesses of pneumonia and malaria, and stayed on the ward with comfort care. But unfortunately, this baby rapidly deteriorated, and 3 weeks later, he died peacefully on the ward. This was very, very difficult for the nurses who saw the baby so often. Some of them became quite attached to the baby, and they found it very difficult to cope with the death. And one of the pediatric nurses approached the pediatrician to ask why he hadn't resuscitated the baby. So the pediatrician organized a team debriefing session. Next slide. So here's some questions about this case. What are some of the features of this case that could impact the nurses and other team members and cause some moral distress? Just write your answers in the chat. What about this case would cause moral distress? How would you feel if you were in this situation, if you were one of the nurses? I know for me, one thing I would probably be thinking is spiritual, that why would this baby be born if it looks like this baby's just going to die? That would be a question that I might have for God, just spiritually. Yeah, so the resuscitation not done and the medical procedure not done. So those two things would make you feel like perhaps the team didn't do everything that they could have. Yeah, frustrated with the lack of resources. So it's possible that there were people on the team that disagreed about whether they did as much as they could or they didn't. So there may be a bit of a conflict in that. So we've mentioned the inability, the medical procedures. Yeah, frustration, maybe anger that it's not fair, that perhaps if this baby was born in another country, they would be taken well of. Yeah, that maybe earlier scans could have detected something. So some of the emotions maybe that I'm seeing in the chat, or confusion, maybe conflict, maybe guilt, like we could have done more. Lack of control over the circumstances. Yeah, lack of referral system. Exactly. Knowing what could help but not being able to do it. That's really hard. Yeah. So lack of proper medical services. That could make some people angry. So how would we, yeah, lack of specialists for sure. How would we as a team, what could we do to support each other in this kind of a situation?
Here's what I found.
I think being able to share with each other on the team, allowing everyone to express their emotions, and recognizing that some people on the team might have a different perspective. Yeah, activities to support each other, listening, discussing our feelings, support groups. Proper teamwork. So I know I've been in jobs where I found it too difficult with a specific patient, then I've actually phoned another nurse and asked if we could switch assignment. Yeah, so applauding each other. So looking at the positives to see what we could do for this baby. Because the baby did die peacefully in their sleep. Yeah, allow themselves to process the loss and share the knowledge. Those are good. And the third question that we want to do is what would you do to create a personal care plan? So I think Erin gave us the homework to create a personal care plan, but maybe we can share some ideas in the chat. What would you do? Like, what kind of a personal care plan would you make for yourself? Yeah, acknowledging the capability and the job well done. So if you think about the personal care plan, you can think about physical, emotional, psychosocial, or spiritual. What kind of things can you do for yourself to create a personal care plan? It's probably a good idea to have one before you get into a difficult situation like this, but what would you do? I know for me, during COVID, it was, I worked in a very difficult place, and I would walk to work and walk home. That was part of my self-care plan instead of driving. I really felt like I needed the time to walk. Yeah, talk about it. And everyone's different. I'm an oral processor, but I know that there's times where I might just need to be quiet and be mindful. I don't know if everyone had a chance to watch the video that Erin posted, but to try and maybe just focus on your breathing, take some minutes of quietness, listening. I like being mindful and just trying to listen and just not think, but just try to really focus on the sounds that are on around me. Yeah, eating healthy food. Anybody else have any ideas? I like to try to start my day with a meditation and just being quiet and try to start on a positive note. Yeah, take time for meditation and prayer. I like to do that at the beginning of the day. I know we talked about crying last week. Yeah, watching movies. I like watching movies too. Exercising, taking walks, reading books, pray, having tea. Yeah. Why am I talking? Being a better listener instead of trying to fix it. Watching a movie that'll make me cry. I know for me, I know my personal triggers, and I often feel over responsible. So I feel responsible that there's maybe something that I could have done when it's not really true. So just reminding myself sometimes to not take too much on. Yeah, having a hobby is really important. Yeah, being submitted to God for sure. Taking a break. I think that's really important. Even if we, like Erin was saying, I heard a doctor who said he was working during COVID in the ICU, and he would have to just step out and do the stop, just take that 1 minute and just breathe and just focus and try not to prepare himself for how difficult the things were going to be that he'd be seeing in there. So just taking even a minute to take a break if you're busy. You know, nurses often just are on the run all the time. Yeah, praying. Yeah, watching a movie, thinking of God's greatness, listening to, for me, I like listening to uplifting music and trying to focus on the positives. Yeah, and I think recognizing that we need each other, which is also a really good thing about this course and our WhatsApp group, is that we can support each other. Even though we all live in different countries, we can support each other that way. Thinking about beautiful things also helps me. I know some people have a gratitude journal, so just trying to think at the end of the day, maybe 1 or 2 or 3 things.
Hey, Esther, I think your connection.
Thanks, Erin.
Yeah, no problem. Sorry, you did great up until the last sentence. Sorry, I think I missed it. All right, well, everyone, thank you so much for being
That's okay.
here with us today. I I'm just going to put in the 3 steps that we were going to try to encourage you guys to look at this week. So if you want to write this down, I can also share it in the WhatsApp chat. But your intention to give attention to your own well-being, being conscious and mindful appreciation of what you already enjoy. So thinking about the positive aspects of work that we really reflected on a lot today, and then finding and doing things that shift you from reacting to responding. And then some of those self-care ideas on the physical, the emotional, spiritual, and relational. So I'll definitely share that. 1 minute, I'll be right back. Sorry, everyone. Serious questions. Because of the thunderstorm, they want to watch TV. So serious issues in my house right now. But anyways, we are finished our course. High five and clap. Great work, everyone. You guys made it. You did 11 weeks, which is amazing. There's a few administrative things, and we've actually ended a bit early today, which is pretty great too. I need to share with you our attendance list. So let me quickly get that in the chat. Fill out this form if you attended today, which is great. And then for those of you who had sometimes some issues with your connection, or you were working and you couldn't attend live, we'll give you about, I'll say 2 weeks. If we give it too much longer, you're going to forget about it. But I'm going to give you 2 weeks to catch up on any of the sessions that you weren't able to do, because we would love to be able to give a completion certificate to as many of you as possible. Last year, we were able to give out 100, nearly 100, which is amazing. Because that just means in East Africa, we have 100 more people who know basic aspects of palliative care in humanitarian settings. So I'm really hoping we can also have a great turnout. Of course, it's not a competition, but we would love to have a good turnout for this course as well, in terms of people that were able to complete the course. So if you ever missed a live session, go back to, I actually can also share it right now, the list that we had, the link for the sessions of the recordings. And I think a lot of that I share on the weekly email. You'll see at the very bottom of the email, the link for the Google recorded session. So I'll just share it in the chat right now, just so it's easy for you if you hadn't seen it. This is the link for the playlist. So if you missed a week, please do review that. And then I'll share the other one. The other link that we need to share from the regular emails that I send out is the quizzes. So you'll find that the quizzes will match up to each week that you missed. So just choose the week that you missed and include your email when you submit it. And then please email me directly that you finished the quiz and which week you did. And that's the email, pchumanitarianecho@gmail.com. And I check that email fairly regularly, so I should be able to get back to you. So I'll give you 2 weeks. So if we're looking at 2 weeks from now, that's about the middle of May. So if you guys can submit your request for that completion certificate, if you haven't done it live and you haven't filled out all your attendance by May 12th, I'll put May 12th as the deadline. And I'll send this all through an email, but catch up on any recordings and quizzes. So we'll be submitting I guess then the 3rd week of May, we'll be creating the certificates, and we'll send them to you by email. It'll be a certificate that will show from PallCHASE, from KEPCA, from Project ECHO, and Two Worlds Cancer Collaboration. And they'll have your name and then the course that we've done. We don't have accreditation at this point in East Africa. It's a bit complicated because we have people signing in from all different countries, but it is something that we are working towards. So please do keep in touch and stay connected. I see there's a few faculty on the call. Would you guys like to unmute and just have any final comments? I also just am going to share a quick link to join PallCHASE. We're a membership network, and we love when people can join. So I'm just going to get that link. But I see Annalise and Dr. Esther and Esther Beatty with us, of course. Anybody want to have any final comments?
Good evening, everyone. I think the session today was quite good on self-care. And we've had a very good discussion and good sessions. I think we need to continue collaborations even as we go forward. Thank you.
Thanks, Esther. And Dr. Esther is always willing. She's one of just a handful of consultants in Kenya, but somehow she has endless energy for us. And she's always willing to respond to SMSs and WhatsApps as well as emails. So do reach out to her. You should have her contact details in the course handbook. If you want to reach out to her, she's great. Annalise, do you have any final comments? Maybe, I think there's a lot of rain in Kenya, so maybe Annalise's connection is not so good. Esther, do you want to say one final word to our participants?
Thank you everyone for your sharing and for your hard work.
Great.
Well, maybe just if anybody knows Francophones that might want to be part of a French ECHO in West Africa, we're starting to think about that. So if anybody on the call knows or has contacts with people who speak French who might want to be part of a course, let us know.
Yeah, definitely. You can reach out to Esther. Also, her details are in the course handbook. Esther, I don't know if you also want to just quickly drop your email in the chat. If not, you can also email me and I can forward the email to Esther as well. So either way, or WhatsApp us. Sometimes I'm not as quick to respond to WhatsApp, but anyways, thank you everyone. Oh, Annalise says here we've received knowledge and skills on how to utilize it, but unless we go out and light our candles on top of a table for everyone to see, it will be in vain. Remember, in palliative care service, there's no vocabulary that there's nothing we can do. Always there's, even if it's just a smile. Thank you, Annalise. Annalise is one of our very committed nurses working in the refugee camp here in Kenya, and we are really grateful for you. All right, thank you everyone. I'll send out an update email just with a few things we've talked about today, of things to follow up on. Please let me put the attendance link in one more time for today. And thanks for being here. Great work. And please do join us if you're interested in joining for some of our future sessions as assistant faculties, or getting more connected, interested in even promoting this program in your workplace with a smaller group of people. Please do reach out and have a really great day. Thank you also for your support in the memory we've had today of my daughter. Thank you. Bye, everyone. Have a great day.
Bye.
Bye.
See you. Bye, Faye. Bye, Millicent.
Bye, everybody.
See you. Bye, Benita. Bettina, sorry.